Um, Today I want to insert catheter for my patient. Um, Before I start, I'm going to introduce myself to my patient, and then I'm going to explain the procedure to my patient. Hello, my name is Tolu Adewuyi. I'll be your student nurse for today. May I know your name, please? Okay, and your date of birth. So I do the two identifier check, and then I'm going to insert catheter for you to help you um, urinate better. Is that okay by you? Okay, thank you. So I'll perform hand hygiene, and then I'm going to provide privacy for my patient by drawing the curtain, and then I'm going to ask my patient, assess him for pain or anything that may cause a discomfort when I'm passing catheter for him, and because the procedure um, may make my patients to feel somehow. So I'm going to drape my patient, make sure to cover him very well, and then exposing only the perineum, the area I'm going to work. Then I'm going to extend my patient's leg. If this is a patient, I'll make sure his legs are extended while I cover each leg with linen to make him warm, and then cover his upper part of the body to expose only the perineum. Then I'll make sure to put on a clean gloves to perform the perineal care for my patient. So I'll have my gloves on, then pick up a clean flannel or towel, roll it over, and then I'm going to move the penis, perform perineal care, clean, and then discard the towel and dispose the clean gloves and the towel very well. I'm going to perform hand hygiene. I have the urine bag here, so I'm going to clip the urine bag to the to the side of the bed to make it ready. I'm just using this to pretend as a urine bag. So right now, I want to prepare my sterile field. I have my patient covered, the perineal side um, open. So I have my sterile kit, catheterization kit right here. I'll check it is intact, and then I'll check the list to make sure everything in it is complete, it is not rigged, not no moisture or any tear. So I'm going to bring it out and remove the list and place it somewhere, put it in the garbage, and then I'm going to position this properly to open the flap away from myself, and then make sure to open the two sides by just holding onto the tip. So I want to make sure the sterile field is not contaminated in any way. And then the last flap, I'm going to move the kit away from me and then open it away from myself. So I have the sterile gloves inside, but before I put it on, I want to gently put um the catheter in on the sterile um field. So I will gently open it and make sure to drop it without allowing the cover to touch the um, sterile fluid. So I'm going to gently open the catheter and try to drop it into the sterile fluid without allowing this to touch the sterile fluid or allowing the catheter to drop on the table. So the catheter is on the sterile field right now. I have my gloves. I'm going to pick up my sterile gloves from the sterile field and put it on. So I don't want to contaminate the sterile field. I'm moving away from it. If there's another table, I'll be using another table for this. So I'll put on my gloves. I'm going to hold the inner part to put on the left hand first. So I'm touching only the inner part of the gloves and then pulling it to myself, and then I'll hold this down. Make sure to touch only the inside, and then I'll hold this with put my hand in the flap and then put my finger into it and make sure to touch only the outer part. So my hand is still sterile, and then I have my gloves on right now. I'm trying to touch only the outside part. So the inside of this is still sterile. I'm putting it inside to discard it. So now I have my sterile field. I'll pick the drape to place between my patient's um time. So I'm going to try to fold it over my hand so I don't contaminate my hand, and try to gently put it just inside my patient field, just touching only the drape and not the patient or the penis. And then I have the second drape I'll be putting here, and then I have another drape. So my hand is still sterile. So I'll be gently putting this over the penis. I'm trying to make sure not to touch the patient or the penis yet. So I have I have um my 10 cc of sterile water. I'm going to open it and just place it to the side, and then I'm going to open this as well to be used to perform the peri care for my patient. So I'm just going to open it and put it to the sides as well. And I'm going to open this to lubricate my catheter, which is still sterile. So I'm just going to put the lubricator to the side. I have my catheter in here. I'm trying not to touch the sterile field as much as possible. So I'm going to open my catheter to expose the tip of it, and then put the lubricator on the tip. So I have the lubricator on the tip. I'm just going to put it to the inside the sterile field and leave it there to be ready for use. So I have the swab stick here um, to clean the penis. So I'm just going to put it to the side to be used. So I will put it to this side so it's ready for use already. So I'm going to hold the penis tip with my non-dominant hand. So my non-dominant hand is now contaminated. I'm going to take one of the swab stick and with one single stroke clean around the penis meatus and discard this. And then I'm going to take another one to clean further around, and then with one single stroke and then discard it. So I have the urine bag here already, and I have the 10 cc sterile water. So I have the tip of the catheter here already lubricated. I'm going to ask my patient to um, pretend he's going to void to bear down and tell me if there's any discomfort. If I feel there's any um, blockage and it's not going in, or my patient is having a loud pain, feeling a lot of pain, I'm not going to go further in. I'm going to ask him questions, but right now my patient is tolerating it. So I'm going to insert the catheter further in until urine is coming out. So right now I've inserted the catheter in, and then I can feel urine is coming out, which is a good one. So I collected the urine into the catheter bag right here, and then I'm bringing out the bag. When I was putting the drapes down, I allowed the shiny part to be towards the table. So right now I have the urine in this bag. I'm just going to place it in the kit in case there's need to use it for um, urinary examination. So I have the 10 cc water. I'm going to insert it into the green part. So I'm going to hold this with my non-dominant hand and insert it, and then I'm going to inflate with 10 cc syringe, 10 cc sterile water. I'm going to inflate the catheter. Just put it in, inflate the catheter, remove the syringe and put it back. And then I will have a gentle pull on the catheter to make sure it is well secured. So when I'm done with this, I'm going to have the second end of the catheter to the urine bag, and then remove the drapes. So right now my hand is contaminated. I'm going to remove the drapes. So I'm going to tape the side of the catheter to the inner thigh of my client, and then put the urine bag down lower than the patient's um, leg, and put it to the side of the bed lower than the patient leg. So I'm going to discard all the things that are no more needed, and put the equipment away. I will discard my gloves and perform hand hygiene. I'm going to cover my patient's back, cover the perineum, make him comfortable, and then lower the bed, ask him if he feels any pain, if he has any question. I will keep him comfortable and warm, put up the side rail, lower the bed, and lock the bed in place, put the call lights beside him so he can call when he need anything. And then I'm going to perform hand hygiene and document my findings. Thank you.